Gender identity disorders are almost always or always either preceded or accompanied by some anomaly in erotic preferences. That is not the same thing as saying that gender identity is sexuality, but it's saying there is some correlation in the real world between anomalous erotic preferences and anomalous gender identity. But people have known forever that there are different classes of transsexuals, that these different types can be quite dissimilar to each other when you meet them in person. Mm-hmm. People have known for a long time that the childhood behavior of transsexuals is not that different from the childhood behavior of many gay men and lesbian women who have a perfectly normal gender identity in adulthood. And people have known for decades and decades that some guys who start out with fetishistic cross-dressing, masturbating into a pair of panties, and then, I'm done with that for the time being, sometimes progress to the point where they have a full-time desire to be as the opposites, to live as the opposite sex. This stuff has been known for, 50, 60, 70 years, is what you're saying. And people it's been known for a long, long time, for many decades, that the autogynephilic type of gender dysphoria tends to be a progressive condition. It's very common that with the biological males, it starts out with basically as a masturbatory activity, which more or less ends after ejaculation. But as the male ages, then thoughts of being a woman, thoughts of wanting to be like a woman start to occur outside of periods of strong sexual arousal until the person begins to think of himself as a woman all the time, sexually aroused or not. And autogynephilic gender dysphoria is very different from homosexual gender dysphoria in this way, in this characteristic of being progressive throughout somebody's 20s and their 30s and their 40s, getting more and more gender dysphoric until you start having guys. Well, I remember when I first started working at the gender clinic, they had just approved for surgery a male to female who was over 70 and who first made an effort to obtain sex reassignment at about the age of 70. Now, that's an extreme case, but the point here is that this is progressive. Autogynephilic gender dysphoria tends to be progressive. That's wildly different from homosexual gender dysphoria, which, if anything, it probably maxes out for a lot of people by puberty, and then many just adapt to their anatomic sex. So homosexual gender dysphoria is almost anti-progressive. It tends to dissipate on its own in many cases, not all cases, obviously. So it has a reverse kind of natural history from autogynephilic gender dysphoria.